Hello everyone. So this video I'm going to discuss with the steps in the fetal circulation. So this is a fetal circulation step. So in my previous video I have also dealt about the fetal circulation and its different structures, which is very important to deal in the steps of the fetal circulation and its blood supply, which there are two blood supply I mentioned, right? So make sure that you are not forgetting while you are writing the notes or the making the notes for the fetal circulation. So this video I'm going to tell about the steps in the fetal circulation. So this diagram is very important that you should make it out, and the yellowish color, right, which I had highlighted, you should make sure that you are not forgetting. So these are the three structures, which is a patent ductus venosus and foramen oval and ductus arteriosus. So you should not forget these three terms together with that placenta, umbilical vein and two arteries. So definition I have explained in the previous video as well. So definition, you can just choose any of the definition which I have mentioned here is a 2, and any other you are getting also will be fine. But this definition I have made it with myself, so you will get a better idea. So I'll just read once. Fetal circulation is a circulation, right? In the word only we can find it out, the circulation, which is occurring through the maternal placenta, not through the fetal placenta. Maternal placenta to the fetal, that is during the pregnancy, not after the delivery. So this is a definition. And now I'm going to deal the main part, which is the step of the fetal circulation. So I have mentioned some of the major points which you should make it out and should not be forgotten as well. So these things, if you are able to write it in a vice versa, I'm sure that you will be able to explain it in a better way. And I have highlighted with the red color and highlighted as well with the yellow color. So these things, if you are making it out, and I'm sure that you will get the better idea. So I'm going to explain in the further points. So first thing is a placenta. You can see in the picture, this is a placenta, right? So from the placenta only the blood is supplied, which is also called the maternal placenta, is supplying the pure blood or the oxygenated blood. In a low term, you can use the good blood from the umbilical vein. Blood is supplied from the placenta through the umbilical vein, and there is an abnormal opening. As I mentioned in the previous video, there will be the three abnormal opening in the fetal circulation, which is the first is a ductus venosus. This will be connected between the placenta to the umbilical vein and to the inferior vena cava. So you all are familiar with the inferior vena cava and the superior vena cava. So this connection is clear out in the fetal circulation by the ductus venosus. So always you should keep in mind that ductus venosus will come first to take the pure blood from the placenta. So once after the getting the pure blood to the inferior vena cava also consists of the some bad blood or the impure blood, or in a better way deoxygenated blood. So it will get mixed, as I mentioned here with the diagram, it will get mixed, and then from the liver as well, little blood will be mixed together, and in superior vena cava, which is coming from the aorta side, upper part of the body, this all blood get mixed with the pure blood which is came from the placenta, right? So this all will be getting a mix and shifted to only to the right atrium, because as we know that first portion getting the blood is a right atrium. So this mixed blood will be getting into the right atrium, which is a mixed blood. And because of the fetal circulation, right, there are three abnormal. So second one is a foramen oval. So second one, make sure that you are not writing the ductus arteriosus or the ductus venosus. You should write only the foramen oval, which will be opening between the right atrium and the left atrium. So because of the gush of blood, means heavy blood pressure racing from the superior, like as the waterfall, you can imagine like a waterfall when it is falling from the high pace in the high level, what will occur is that where the more spacious is there, it will just gush towards that direction rather than going in the vertical form. So similar to that, from the blood supply, blood is supplied from the superior vena cava, is gushed toward the right atrium to the left atrium, okay, instead of going to the right ventricle. So this shifting will cause the blood is shifted in a more part to the left atrium to the left ventricle. As you can see there, number 4 and number 5 is the left atrium instead of the right ventricle, and the left atrium to that is vice versa. As we are shifting the blood, left ventricle it will shift. So this whole mixed blood is shifted to the right atrium, and then left atrium, and then to the left ventricle. So because of what reason means, you should make it out with a foramen oval. So you got the idea, right? So now leftover blood is in the left ventricle. If it is remaining here, what is there is always the ventricle is connected with the pulmonary artery, right? Pulmonary artery or the pulmonary trunk, which I mentioned in the slide. So pulmonary trunk is associated with the lungs. So it will directly go to that blood will be going directly to the lungs. But because of the immature lungs in the fluid will cause the blood is not taken into the lungs. Instead of that, blood will be shifted back. Only the some nutrients will be taken from the fetal lung, because fetal lungs is immature, means it is filled with the fluid. Filled with the fluid means not in an adult. What things are there means carbon dioxide and the oxygen, right? So this thing will not be present in the fetal, only the fluid, which will let the blood to turn back instead of taking inside and purifying. So gushing of the blood back to the lungs or the pulmonary trunk or the pulmonary artery. Again, there are third one abnormal opening, which is called the patent ductus arteriosus. I have mentioned in the previous video as well. You can just check it out if you are forgetting. Here also I have mentioned. So patent ductus arteriosus is a third one abnormal opening between the pulmonary artery and the aorta. Okay, so this blood turning back from the lungs will be shifted to the abnormal opening, then towards the aorta, and obviously we all are having an idea that aorta will always supply the blood to the whole part of body. So like this. So in the previous slide I have mentioned about the aorta, right? So from the aorta the blood is supplied to the whole part of the body. Together with that, what things will occur is some of the deoxygenated blood, means impure blood, right, which will be coming again through the umbilical artery. As I mentioned in the previous video, umbilical artery, there are two umbilical artery and one umbilical vein. Vein will always carry the oxygenated blood or the pure blood, and the artery will always carry the deoxygenated blood, which will be consisting of the two. So this deoxygenated blood will be taken to the placenta again, and it is circulated by the umbilical vein, again vice versa, as I've explained. So I will give you revise again with a very short, and hope you will get the best idea. So first is a placenta. From the placenta, blood is supplied through the umbilical vein, always a pure blood. So this pure blood is shifted through the abnormal opening called ductus venosus from the inferior vena cava blood and the umbilical vein mixed, and that blood will be shifted to the right atrium, and along with it the gush of blood will be supplied also from the superior vena cava, which will be deoxygenated fully. That blood gush will be letting the abnormal opening foramen oval to gush the blood towards the left atrium instead of the right ventricle. So shifting of the blood to the left atrium to the left ventricle, and vice versa pulmonary artery, right? As pulmonary artery shifted to the lungs, because of the fluid collection it will be shifted back to the pulmonary trunk or the pulmonary artery. Again, there is an abnormal opening called ductus arteriosus between the aorta and the pulmonary artery. So again that blood deoxygenated, I should say that, but totally you can presume it's a deoxygenated, because some of the blood, good blood, also are present, like the oxygenated blood. It is a mixed blood, you can better to mention. So this mixed blood will be shifted to the aorta through the aorta to the all part of the body, and remaining of the bad or the impure or the deoxygenated blood is shifted from the umbilical artery to the placenta. So this is a cycle of the fetal circulation. So hopefully you got the better idea. And thank you so much for your active listening.